welcome to our webinar, Talking with Your Doctor, How to Get the Most Out of Your Visit. My name is Debbie Leone, and I am the Information Services. Oops, wait a minute. Sorry, I hit the wrong thing there. I am the Manager of Information Services for the Epilepsy Foundation in Minnesota. We are really excited to be hosting this webinar tonight during Epilepsy Awareness Month. Before we get started tonight, I have a few housekeeping procedures and items to go through. This is a 75-minute webinar, so it'll be about an hour and 15 minutes. For the best webinar experience possible, we do recommend that you close out of any extra windows that you might have open, especially any kind of streaming services, music or video services that use up a lot of bandwidth. We will be issuing certificates of attendance to our attendees, and those will be emailed out to you within a few days after the webinar is over. And then we are recording this webinar, and there will be a link posted within a few weeks after the webinar itself where you can request to see the recording if you want to watch it again, or for those who may have missed it. I do want to mention that while the Epilepsy Foundation of Minnesota is hosting this webinar, all content and discussion points are being led by our guest speakers, Dr. Jessica Winslow and Dr. Douglas Smith of the Minnesota Epilepsy Group, who I will be introducing shortly.
Debbie?
Yes?
Can you turn on the PowerPoint?
I thought I had it on.
Don't see it.
Okay, I am sorry. So what
No
am I
problem.
doing wrong here? I have it up. Oh, you know what? I don't. Sorry about that, folks. Technical problems. And I am not known to be the most technically savvy person. So let us. I thought something looked a little odd. Okay, that's better, isn't it? Sorry about that. Yes, so as I was saying, our content is being presented by our guest speakers, and the information being shared is to inform you of the aspects of effective communication with your doctors. However, any possible potential treatment options should be discussed with your medical provider. Now, let me get back to this. Okay. We will be taking questions tonight. In order to ask questions, if you look at the bottom of your screen, you will see a Q&A button that's circled here in red. You can click on that, and then when the box pops up, you can type your question in and you can hit send. We will be holding those questions until the end of the webinar, but we do invite you to ask them as they occur to you throughout the session. I also wanted to note that just to avoid confusion, we have disabled the chat feature. That voice you heard asking me to turn on the PowerPoint was Mary Mavison, our wonderful support person at the Epilepsy Foundation of Minnesota. And she's there in the background to handle all those technical aspects and make sure that we stay on track. If you do have any kind of technical problems throughout the webinar, you can type those into the Q&A as well. Mary will be watching that and she will respond to you. I also want to mention that we do currently have the closed captioning turned on. So if that's something that you prefer not to see, you can disable that by going to the bottom of the screen, and you should see something that says live transcript. You can click on that and then click hide subtitles. If you don't see live transcript, you probably see three little dots at the bottom right of your screen. You can click on that, and then you should be able to see hide the subtitles. Okay, so our objectives tonight. We have three main objectives. One is to gain knowledge on what questions to ask your physician and or your nurse, to learn what individuals and caregivers can note to be helpful with clinical appointments and treatment, and to improve your awareness of tools that will help you to track important seizure-related information. So before I introduce our speakers, I do want to start out with a poll question. So Mary, if you could pop that up there for us. So we just want to have an idea of who it is that we have in our audience tonight and who's attending. So if you could look at this poll question and choose which of those, and you can choose more than one, best describe your relationship to epilepsy. And we'll just give it a few seconds so that everybody can have a chance to participate. It looks like we're getting close to full participation. Okay, Mary, would you want to go ahead? I will, oh, we're up there now. Yes. So it looks like the majority of our attendees have a child with epilepsy, about 40%. We have about 30% who have epilepsy themselves, 10% with a friend or coworker, and another 10% with a spouse or partner. So that's really good information to know, as our speakers are from the worlds of both adult and pediatric epilepsy. So I will close out of this. Okay. So now I'd like to present or to introduce our presenters tonight. Dr. Jessica Winslow is an adult epileptologist at the Minnesota Epilepsy Group. Dr. Winslow graduated from St. Olaf College before attending medical school at Georgetown School of Medicine. She then completed her residency and epilepsy fellowship at Cleveland Clinic. Dr. Winslow's areas of expertise and interest include epilepsy surgery, patient education, the bidirectional relationship of epilepsy and mental health, and EEG and SEEG. Dr. Winslow focuses on getting to know patients and their individual stories in order to find a plan that's best suited for them. And outside of medicine, Dr. Winslow enjoys traveling, trying new restaurants, being outdoors, and spending time with her family. Our other speaker tonight is Dr. Douglas Smith. Dr. Smith got his undergraduate degree in biology from the College of New Jersey and his medical doctorate from New Jersey Medical School. He did his pediatrics training in Baton Rouge, Louisiana, before doing both his pediatric neurology and pediatric epilepsy training in Philadelphia at the Children's Hospital of Philadelphia. He moved to Minnesota in 2016 to join the Minnesota Epilepsy Group, where he has practiced for the last 5 years. He currently runs the resident and fellow training program at the Minnesota Epilepsy Group, runs the Tuberous Sclerosis Center of Excellence, and founded and runs the Genetic Epilepsy Clinic at the Minnesota Epilepsy Group. Outside of medicine, he enjoys hiking, birding, and foraging his way through Minnesota state parks while trying to keep up with his 3-year-old daughter. So I will, with that, turn things over to Dr. Winslow.
Okay, so as far as I know, everyone can hear me. So I'm Dr. Jessica Winslow. Again, I do adult epilepsy with Dr. Smith, who does pediatric epilepsy with Minnesota Epilepsy Group. And so the topic we were posed with was talking with your doctor. So happy to be a part of this conversation. Yes. Neither of us have any relevant disclosures. So first, just wanted to start with what type of doctor you might see for treatment of your seizures or epilepsy. And for the purposes of this discussion, just the very brief definition of repeated seizures is epilepsy. So some patients might first see their general practitioner or family medicine doctor when they have concerns with seizure. Some might see a general neurologist, who is a doctor who would treat seizures as well as other neurologic conditions. And then some might see a neurologist who subspecializes in epilepsy, called the epileptologist, which is what Dr. Smith and I are. We are epilepsy specialists. And so we are going to be approaching this conversation mostly from our personal role, which is as epilepsy specialists. And then sometimes patients might see all these types of providers in the hospital or emergency department setting, so in the hospital. So the goals. So the goal of the physician is to improve seizures and also improve quality of life while living with seizures. And very likely the goal of the patient and the family member is very similar, but you may have some unique goals. And so it's always important to share those. So I always just want to preface the entire conversation with that. So the outline of this discussion, we're just going to kind of take you through, the first visit, follow-up visit, and what to kind of expect between visits. And so we're kind of going to go in that framework or order. So the first visit with the seizure doctor, what will that entail? So first we will review the general medical history, review your birth history, talk about any injuries or illnesses involving the head or the brain. And then we'll spend a lot of the time talking about the description of the type or types, potentially multiple types of events that would be concerning for seizures. And we'll have you go through describing them in detail. So I really kind of ask my patients and or the family members to describe in detail what that event might feel like. So kind of take me through the beginning of it and how the event may progress or what you've. And we would ask, what does the patient feel before the event, during the event, after the event? We'll try to kind of ask an open-ended question that allows you time to explain what that feels like. And then we'll probably have some specific questions and kind of make you slow down and kind of review some specific aspects of it with us. And so that's very, very important and helpful for treatment of seizures. And then if you have any videos of these events, that can be very helpful for us to review those videos with you. So if you have those prepared ahead of time at the beginning or before the visit, that's best. Obviously, we won't have time to watch multiple minutes of video, but if you have a select couple minutes of video or a couple events for us to share with us, that can be very helpful. So please bring those with you. Then if you've had any prior treatment for these seizures or events, then we would review that. So for example, if you've had any medications that you've tried, what happened with those? Was there any side effects? Why potentially was that treatment changed? So those are some of the core aspects of the first visit with the seizure doctor. So the follow-up visit. So after that first visit, which is a longer visit, reviewing all your history and what's been going on, the follow-up visits will be the next time you come back to see the doctor. And so we'll review similar concepts, but with this visit, we'll just remind you that it's a shorter visit and it's meant to be an update to the prior conversation, a continuation of the conversation. So with that visit, please bring an updated current medication list because we want to know if there's been any changes. Next, we would review an update on any significant general medical changes, so surgeries, hospitalizations, any big changes. We won't spend as much time talking about those other medical issues. What we will do is spend the majority of the time, again, discussing those seizures. Next. So I want to just take you through a few more details of the types of things we're going to focus on in our seizure discussion. Again, we'll be talking about updates to those seizures or events concerning for possible seizure. One thing I want to highlight, and it'll probably be mentioned a couple more times during this conversation, is calendar or a diary of events. So I can't emphasize enough how helpful it really can be for you to have a record of some sort. So as with anyone, it can be kind of hard to remember how many times you've had an event and when it exactly happened. So it's very helpful just to write that down someplace for you to bring that information with you to your visit. And so patients do it in a variety of ways. So sometimes they just have a old-fashioned paper calendar they write it down in. Sometimes people have apps on their phone or they have notes within their phone and they can write it down there. And so the things we ask people to try to keep track of is what date and time did the event occur, description of the seizure or event, how long did it last, and then any possible triggers you notice. So for example, I was sick with this illness at this time, and I can see that, and then we might be able to see if it's similar timing to the seizure. If you missed any medications, if you're on your menstrual cycle for women, if there's any particular stressors going on, sleep issues, alcohol use, and any other possible triggers like a big exciting family event or something. So all those different events that kind of are on your calendar are helpful to note. If during the event you are given any extra seizure medication, that would be good to note. So kind of writing all these things down on the calendar, it might seem labor intensive, but again, it's very helpful for us. And what we'll do is we'll review the calendar together and we can help identify triggers or and frequency of events. And it allows us to compare, you know, 1 month to the next, one visit to the next, and that can be, again, very helpful for us. And when we go through our conversations, we're going to talk about change over time. So for example, what's the change in seizures this visit compared to the prior visit? And if we instituted some sort of intervention like a medication, we're going to compare how does the seizures compare now to how they were before. Things we can look for as in terms of change include the frequency of the seizures. Did that change? Did the characteristics of seizures change? The severity, so how big the seizures are, and the duration, so how long a seizure lasts. So as you can see, if you can write down those things on your calendar and whatever calendar type works for you, then that can be really helpful for us to, you know, have this conversation and see how things change over time. You know, we kind of like the nitty gritty, all that data to kind of work with. And then next. So I'll let Debbie talk about this.
Okay, yes. So Dr. Winslow asked me if I would talk a little bit about some of the seizure tracking tools that are available. There are really two basic general categories of options. One is kind of the old school paper options. That could be a seizure calendar where, you know, it could be something as simple as a wall calendar or a pocket calendar. As you can imagine, with all of the information that Dr. Winslow had mentioned that is good to gather, a larger calendar might be a little bit better because it will just give you a little bit more room to write some things down on. Some people will also keep a seizure diary, which will, you know, that again might not be on a calendar grid, but it's a way you can record the dates and the times and all of the information that Dr. Winslow just mentioned that would be helpful to have. There are some templates available through the National Epilepsy Foundation, and I have put the link on here, and I realize that in a webinar you can't click on a link, but I will provide this information via email when we send out your certificates of attendance so that you're able to access those. And those are just some templates for a calendar and for a diary that can just give you some guidance if you're not quite sure where to start in tracking some of this stuff. The other option are apps, and these are usually available for your phone or for your computer, and a lot of people are more comfortable these days using something like that. Many of the, and these are not certainly all of the apps that are out there. These are 3 of the ones that we know of at the Epilepsy Foundation that people have reported using and liking. Again, each of them will have its own features, and some of them are with some really cool bells and whistles because, you know, but the main thing is that they're all going to help you track that basic information about when are you having seizures, how long do they last, and that type of thing. Some of them, for example, the My Seizure Diary has a feature that also helps you to manage your medicines, to help, you know, track your side effects. So what I would suggest is that you look at some of these if it's something you're interested in, if you feel like that would be more useful than just paper and pen, and you know, see what the different features are and which ones have things that would really be helpful for you, whether it's medication reminders or being able to log in when you've taken your meds, tracking what your moods are. You know, there's all kinds of things these things can track. I will say that as cool as some of these apps are, and they, like I said, they have a lot of neat bells and whistles, and some of them are going to say, oh, well, we can, you know, electronically send information to your doctor. I really do suggest you talk to your doctor about what the best way is that they would like to receive the information. there are some apps out there that say, oh, well, we can, connect directly to your doctor's system. Well, that may not be possible. So you want to make sure that, you're gathering good, solid information, but that you're also providing it to your doctor in a way that's going to be useful, because the entire point of doing this is to make sure that your doctor has information that can help them to make the best treatment recommendations for you.
Great. Yeah, thank you very much for reviewing that. Yeah, so I will just say every patient finds what works best for them, and is a way to kind of show and share information with us. And yeah, other patients who might use similar apps like Debbie mentioned can be helpful and share tips and their opinions about them. So great. So continuing that seizure discussion. So after we've talked about the seizures, reviewed your seizure calendar or diary, then usually we talk about medications. So first questions about the medication is, are you taking the meds, or is there any reason you're missing meds? So if you are missing medications, we want to better understand why. So is it just that you forgot to take the medication? Do you have some resistance or hesitancy to taking the medication? Are there issues with availability, like pharmacy issues or cost concerns? So again, any barriers to getting the medication that we can potentially help with or explain. And then medication side effects. So do you have any clear change in your side effect concerns? Ask us what those symptoms may or may not be, and then we can review with you whether or not we do think they could be related to the medication and evaluate how big of a problem that is for you. In addition, we'll be asking you questions to kind of screen for side effects as well too. So, but usually we just try to ask your opinions first, how you feel on it basically. And then, portion of the visit, usually near the end, will be what questions do you have for the doctor. So please come prepared with what questions you might have, write them down. I usually recommend, because then, the middle of the visit, you might forget unless you've written them down. During the course of the conversation, obviously, you'll probably come up with new questions. And then just want to emphasize, please don't be afraid to ask anything that is on your mind. If there's no such thing as a stupid or inappropriate question when it comes to your health. So we would rather, answer those questions and address them to make you feel comfortable and have you leave really feeling like all your questions were addressed as best as we could. Next. Okay. And so the next steps for care. So workup. So in just basic terms, when we try to understand someone's epilepsy, we often do at least a couple tests early on, especially. So anyone with a new possible seizure, we will very likely be recommending that you get an MRI of the brain. So that's brain imaging that looks at the structure of the brain. So we'd be looking for any problems with the structure of the brain that can be visible in that study. And then the second test that we pretty much recommend for everyone at least once would be an EEG or electroencephalogram. So kind of like this picture you see here. So the patient will come in and will basically your head will be measured and marked in a certain way. And then we put these cording electrodes on your scalp. They're kind of put on there with paste or glue. And then we have you just kind of do a couple things, but otherwise lay there and try to take a little nap while we record your brain waves. And so recording the brain waves is really important for seizure evaluation, because what seizures are is abnormal electrical activity. So the EEG is looking at that electrical activity, and seizure neurology specialists like myself and Dr. Smith, we're the ones that review those EEG recordings, and we kind of make sense out of them for you. So that can be really helpful for us. So the MRI and the EEG are the two basic studies that usually are done at the early evaluation for potential seizure. And then when over the course of follow-up, as you're continuing in our evaluation of your seizures over time, sometimes we might have to repeat those studies as well. That can be somewhat different based on each individual. And then lab work. So that may be needed on a more ongoing basis. And again, the frequency of needing lab work or blood work can be variable. So that's the workup portion. And then the next aspect, so just considerations for medication and treatment. So that'll be influenced by a variety of things. So we don't always pick the same med for everyone. The dose isn't the same exactly for everyone. So we will take into consideration the type of seizures that you have, the presumed cause of your seizures can influence what choices we make about treatment. Seizure frequency and severity will guide treatment. So for example, you're still having seizures or they're bad, then you'll need to increase your treatment versus if you're doing well, not necessarily will need to increase anything. Other health or medical conditions or other symptoms or complaints like side effects, those will be taken into consideration when we choose your care. So for example, any kidney disease or liver disease, if you also have headaches, those things or mood difficulties, those kind of things can guide what treatment we recommend for you. And then prior medications that you've used and what your experience was with those medications and evaluating the potential benefits or potential negative side effects with those meds. Those will play into our medication choices and suggestions. And again, this is all a conversation with your doctor. And because we're going to focus on what your seizure and personal goals and preferences are when we help select what treatment we're recommending for you. Next. And so now if you're kind of coming to the end of your clinic visit, you know, both the first visit and the follow-up visits, by the end of the visit, the hope is that you're understanding what the diagnosis is, you know, so it's clear thought to be epileptic seizures or not, and if so, what type of epilepsy it is, understanding the suggested plan for workup. So do you need further brain imaging like an MRI? Do you need EEG? Is blood work recommended and needed? And at the end of the visit, we'll be discussing whatever change to medication that we're recommending. So if there is a change especially, then we would review potential side effects with the increased medication dose, for example, or if we're changing medication, discuss what type of side effects to monitor for. And then we try to give you a sense for reasons to call the office or go to the hospital. So for example, starting some new medication, I might say over the next couple of weeks, you might feel a little bit more tired as your body gets used to the medication. But if that goes away and you feel better, then that's okay. No need to call the office. But if you have X thing happen, for example, a really bad rash, then I need you to call the office right away. You know, things like that, specific recommendations. And always call the office for any worsened seizures or things that you're concerned about that need urgent addressed. And at the end of the visit, we'll also make suggestions for what the next visit should be. So when should the next visit be? And we do suggest that we make that appointment for the next visit early. Sometimes, you know, with your other doctors, maybe your primary care doctor, you can call and make an appointment to be seen really soon, like in the next week or something. Unfortunately, our schedules sometimes get really booked up, and so we don't always have last minute appointments available. So we do definitely suggest that, you know, if we recommend you make a follow-up appointment to be seen in 3 months, please do make that appointment ahead of time. So make sure that you can get in to see us promptly when we discussed. Next. So between visits, so, you know, now you're between visits and what should you notify us about? So please notify the office if your seizures are worsened or if you're having any concerning issues with your medications. So for example, you feel really terrible in the new medication or some of the things that you were told to look for are occurring and you need to notify us. So please notify us. Notify the office if you make any changes in your seizure medication. So for example, if you change how it's taken and you're not taking it, how it's written, you know, on your instructions anymore, you need to discuss that with the office. So for example, a lot of our medications are prescribed to be taken twice a day. So if you were to start taking it only once a day, that would not be an appropriate way to take it. And we need to discuss that with you. Videos, we mentioned before, but videos are an epilepsy doctor's best friend. So if there's any new type of event that's happening or something different, or if you're just trying to even get an example for us to review, then take a video of that and bring it with you. And oftentimes it's a family member doing the video, not the patient themselves. If testing and labs are done, then you should get an update from the clinic after that testing is done. Sometimes updates will come in the form of mailings, meaning, you get your labs done, we review it and all looks well. So we might mail the results to you. Phone calls are common from our offices, and similar offices to ours, or secure messages. So different doctors' offices have different other secure message systems. So they're usually like, they send an email and tell you to go check the secure box. So it's, there's a private login for your privacy. And then I will emphasize that please answer phone calls from your doctor's office. So a suggestion would be to take the phone number for your doctor's office and put it in your phone. So if your doctor's office is calling, then your phone, helps tell you that's who it is that's calling. And oftentimes we do have to call you, and we usually try to leave a voicemail to let you know who we were and to call us back. So please make sure you have space on your voicemail so that someone could leave a brief voicemail to tell you to call us back and let you know who was calling. And then also a note is that communication from your care team, the doctor's office, is likely to come from a nurse or a front desk. So oftentimes it's not the physician or doctor calling you directly. Oftentimes it's the nurse or the front desk reaching out to you. So please know that they're an important part of your team, and please, talk with them about whatever it is we need to address between visits. Next. Individual treatment, so you as a person. So we kind of mentioned this a little before, but it is really important that we get to know you in a more individualized level. It does allow us to tailor our treatment to best suit your needs and your personal life. It gives a more individualized understanding of the person, can be very helpful and kind of establish that mutual shared relationship. So things we'll want to know or, take into consideration is you as an individual. So we'll be mindful of your age, gender, are you in school, do you work, what's your living situation? So for example, do you live alone? Do you live in a group home? Are you living with family or roommates? Do you drive, or is there other particular types of activities that you do that could impact your seizures? And then other health considerations like medical illness and things like that. And then what are your seizure treatment goals? So for example, seizure freedom, is the #1 goal versus just more of a balance of the medications and how you're doing with the seizures. And then how are seizures impacting your life? So for example, that can be really different for some individuals depending on their driving status or their living status or the type of seizures they have. So some seizures can cause people to lose consciousness and fall down and be injured. And some people's seizures are smaller types of symptoms. So it can be quite variable for how each seizure can impact someone's life, both at the individual level as well as the type of seizures that they have. And then what are your medication and treatment preferences? So with consideration for potential side effects as well as potential benefits. That's important to keep in mind. Next. So this is one of the questions that was posed to us to address. So what can patients do to improve their own health? So I think the #1 thing that comes to my mind is taking the medication as prescribed. So, if it's thought that you need to take this medication to control seizures, then that's really the most important thing. And the best way to control your seizures is take the medication as prescribed. If you are taking them differently than prescribed, then you need to notify the doctor, which I mentioned before. Pill organizers of some sort are highly recommended. So the most basic and common type is these, oftentimes colorful pill organizer boxes that say Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and they'll have an AM, a PM, or midday slots on them. And you just put your pills ahead of time into these slots for over the course of the week, for instance, all the meds in the AM and the PM. And we definitely recommend these boxes because it helps, #1, organize everything in advance so you don't have to keep going between bottles. And then in addition, if it's all laid out in front of you, so it's Monday morning and you're there brushing your teeth and, did I take my medication before I brushed my teeth, or was I going to take it after I brushed my teeth? You could just consult your handy dandy pill organizer to remind you if you actually took the pills that day. So it can be very helpful for you as an individual, as well as if family members or caregivers are helping you organize your pills. It's a good way to make sure you're not missing any medications and to not get that confused. One other tip is that if you're out and about, it's oftentimes helpful to have a backup dose of medication with you in your bag. Or some patients have even told me that they find it really helpful to use these like pill holder key ring things. So you just kind of put it on your key ring, and then there's a few pills in there. So if you're out and about and you're not back at home to take the pills that you have at home, then you have the pills with you already. So you can take them and not miss the doses. Other things patients can do to improve their own health is the seizure tracker diary calendars setup that we discussed. Again, very helpful. And make your health a priority. So take care of yourself. So definitely important to get enough sleep. Sleep is very important for the brain and brain health. And if people have poor sleep, it's not uncommon that they can have worsening of their seizures. Nutrition, get good nutrition, good hydration. Hydration is important. Keeping physically active, if at all possible, is important. Mental health can definitely impact seizures. It's, again, not uncommon that people will say that they had a really stressful period in their life. They're emotionally overwhelmed and possibly not sleeping as well. And that's maybe when they're more at risk for seizures. So addressing all of those concerns is very important. And another thing you can do to help improve your own health is notify the office if you're having significantly worsened seizures or those things that we discussed before are important to notify the office of. And advocate for your needs. So tell the doctor your questions and concerns, ask questions. So, you know, sometimes we don't think of every single thing to ask you. And so I have patients all the time bring up very important things for me to know and very good questions. And so please bring those questions with you and ask those questions. And then the final thing that I kind of mentioned before is make sure you make those appointments in advance so that you have an appointment scheduled to make sure you have time to see your doctor and that your ability to have those conversations with the doctor are delayed due to.
All right.
I'll turn it over to Dr. Smith.
So now it's my turn. Let me start by thanking y'all for inviting me. I will say I'm gonna start with an apology too, because I was actually really excited when I was invited to give this talk, because this is something I've never talked about before, and it seemed like it was an interesting conversation to really think about. Especially when I thought I got the interesting part, which is, what are tips and tricks for how to communicate to avoid some of these pitfalls. And then when I heard myself give the talk, it really sounded insanely condescending, because really it's a whole lot of, when you talk to me, please talk to me this way. And that's not at all what this is intended to be. I think that there's a lot of tips and tricks on how doctors can improve our end of the communication, but unfortunately, unless your doctor is either myself or Dr. Winslow, they're not attending this lecture. And so there's not a whole lot that I can do to talk about things they can do to communicate better. And so the way that I'm approaching this is I want you to think of your doctor as a fellow human who often has good days and bad days, sometimes has 20 things on their plate, sometimes are answering 20 phone calls or 20 patients, has sometimes really, really busy, and sometimes things don't go absolutely perfectly. And ultimately, we don't want that to impact you or your children any more than you do. And so what I'm going to be talking about are kind of ways in which you can recognize some of those issues where there's some kind of disconnect, and then what are some approaches that you can do to kind of make sure that you're both meeting our mutual goal of, we want you to live your best life, we want your kids to live your best life without fail. We always want that. And if you ever feel like we're not on that same page, again, what tricks can we use to kind of make sure that we are meeting those needs? And so I'm going to try to avoid repeating myself or repeating what Jess has so well covered, with the one exception, and that's going to be talking about goals, because that's really, I think, the most common reason why there is a disconnect. But I also want to touch on a couple of previous things that I don't think that were specifically mentioned. When it comes to the seizure calendar, one thing that can be really, really helpful that wasn't specifically mentioned is anytime there's a change in dose or a change in medication, mark it on the calendar. We talked a lot about the details about the symptoms that you're experiencing, the seizures themselves, but 99% of our job is figuring out which medicines are helping, which medicines are hurting, whether or not there's benefit in going higher, whether we need to back off of a medication. And we go through our electronic medical record, we have all the information there, but if it's all in the calendar, it makes things infinitely easier for us. and it can make things very, very clear. And so it's a very simple ad to say, okay, I started my new dose today and just marked, increased trileptal today. And that can be really, really helpful for us. Another thing, Dr. Winslow had mentioned very rightly, please make sure that you can actually receive voicemails, because it can be very challenging sometimes to reach patients. Additionally, if you ever call an emergency on-call provider, please do not have on the block where you don't receive restricted phone calls. We're 99% of the time going to call back from our cell phones, and we block that so that you can't actually see our cell phone number. And if we can't get through it, it's actually going to delay the amount of time it's going to take for us to get to you. I don't know about you, but I don't get any spam phone calls that are blocking their number anymore. They're all just making up fake numbers. And so I would strongly encourage everyone to take a look at their phone and disable that feature, because especially if you're calling the on-call provider, because that does unfortunately delay care for us. And so continuing the topic of, Dr. Winslow is looking at this in the perspective of what can you do for yourself primarily, because she's an adult epileptologist. I'm a pediatric epileptologist. And so are there any specific different things that parents or caregivers need to do in order to support their loved ones with epilepsy? And honestly, I don't think there's going to be anything new here that you haven't already heard, in terms of if they can't do some of these things themselves, in terms of creating that information in the seizure calendar, tracking their seizures, tracking their medications, all of those things. If you can be of service to them in doing that service for them if they're younger, or when they're age appropriate, when they're starting to able to transition that responsibility so that you can oversee it, that the children are doing it themselves. Additionally, most individuals that are having a seizure are not capable of videotaping themselves when it happens. If they are, that's often a bit of a red flag for us. However, if you are present, you're often the person we're going to ask to videotape that. And for the pediatric world, a lot of times that actually will take the form of a baby monitor. A lot of times those baby monitors actually record videos of anything that happens in the middle of the night. And so you may not have to personally record it, or just find means in which you can get a video of it, so that we can kind of make the best, most intelligent decision about what episodes that you guys are seeing at home, and make an intelligent decision on it. Everyone who is going to be at home regularly, anytime you have a kid or an adult in a home, there should be at least one provider who knows what to do when someone has a seizure, who knows seizure first aid. And the Epilepsy Foundation is a fantastic resource on what to do there. That is a whole talk in and of itself, so I'm not going to go into depth there. But if a loved one that you're spending any meaningful amount of time with has epilepsy, it is absolutely worth the little bit of time it takes to become well-versed on what to do if they have a seizure. And along what goes with that, make sure that you know what rescue medication they have, where is it, and when do we need to use it. Everyone has their own plan. We have some default ones that works for most of our patients, but generally speaking, those are highly customized. And so again, if you are taking care of someone or you love someone with epilepsy, that's a very important question in order to know in order to know how to respond in the event of a seizure. Next. And so this is where we're going to get into, you could potentially misquote me or quote things out of context where it's going to seem like I'm lecturing a little bit. So please, I hope you understand the context of where I'm coming with here. I think that the main ways in which sometimes there's a disconnect is in these three ways. And actually, I should probably put miscommunication first, because this is probably 9 times out of 10 where things go wrong. And that sometimes I hear things differently. Sometimes I say things differently. And that's why I'm lucky enough to have a nurse in on most of my visits who knows what I'm thinking and can clarify when I say, no, I meant to say trileptal, and I was actually saying Keppra, for example. And so I know I miscommunicate sometimes, and certainly patients can miscommunicate sometimes. And so if I'm saying one thing and it doesn't really jive at all with what's going on, feel free to ask those clarifying questions and just keep on going and saying, wait a second, we're going up on the medicine. Why are we going up? I just told you I was having a side effect. And I might say, oh, I thought that what you're describing was actually a seizure, not a side effect, etc. What's going to come up over and over and over again, and when we talk about this, is that there is simply not enough time. As Dr. Winslow had mentioned, we book out for quite a bit. And we really want to extend our expertise to all the kids and all the adults that need our expertise. And part of that is that we have to schedule the appropriate number of people per day. And as you're probably everyone in this room is aware, there are some visits that take 10 minutes and there are some visits that take an hour. And we don't ever want to cut you off at a really important time when you're telling us something really, really important. And so there are some times where we just have to kind of push things along because some other patient took a lot extra, or we can tell this is going to take a lot of extra time. And so while I'd love to talk about things that are going on in your life, and I'm definitely very guilty of talking about, you know, what was your Halloween like and the things that are really salient to your personal life, sometimes I have to cut through that a little bit in order to make sure I can cover all of your medical needs first. And this is obviously extends for the visit, but extends beyond the visit. It sometimes means for phone calls. Well, those phone calls, a lot of times, they're not actually, that's time where I actually might be doing in between patients. And so I only have 5 to 10 minutes before I need to go in and see another patient in clinic. And I don't necessarily have as much time as I have during a clinic visit. And so if we're being terse, if we're being direct, it is not necessarily because we're trying to be rude. It's because I also have obligations to other people. And if I don't have enough information, if there's more that we need to talk about, well, then we can have a conversation of, can we continue this conversation at another time or make a scheduled time at another time? And I know that everyone's busy. I know that's not just us, unfortunately. And sometimes it just requires that we're just having more thoughtful about that piece. Misaligned goals is probably the second most common cause for this. And I think that when I first became an epileptologist, that never really occurred to me as something you could ever have a misunderstanding about, because I mean, we both want the same thing, right? We both want 0 seizures and 0 side effects on one medication, or preferably 0 medications. We all want that. But unfortunately, the majority of the people that have come to see me, I'm stop number 2 or 3 in terms of who's providing the epilepsy care. And unfortunately, a lot of the people that I see, it is not likely that I can achieve either of those goals, or I can only achieve one of them, unfortunately. And I tend to be, on my very first visit, I'm very deliberate in saying specifically what I think is a necessarily expected goal. And so I'll often start by saying my goal right now is exactly that: seizure freedom, side effect freedom. And if that becomes unrealistic, I do specifically communicate that. But sometimes that's not necessarily what your goal is. A lot of times the goal is, you know what, these are just little twitchy seizures. I don't care about them. I don't want to be on more than a tiny dose of the safest seizure medication. That's all that I'm willing to accept. And if you don't communicate that with me, then I can't be a partner in your care, because ultimately I can't make you do anything you don't want to do. And I definitely can't make your teenager do anything that they don't want to do. I've been trying for a long time and have been failing miserably. And so ultimately I'm a coach, is the way I see it in all of this. And you or your loved one is the player in this game. And I can only kind of give you the tools, give you the approaches about how we can tackle this problem. Sometimes I can be a more aggressive, hands-on coach that's micromanaging every single aspect. And sometimes, you know, when people are ready to just take the ball and run, then it's my job to kind of point them what direction to go in. But I need to know what your strengths are. I need to know where you're struggling. I need to know where you want to go in order to give you the right information to achieve those goals. And that goes all right along to what Jess said, Sex. I think it's really important to repeat this. If you have a question, even if it seems absolutely ridiculous, just ask it. We know half the time when you're on the verge of it. You know, I can usually tell whether or not the visit's going well, and especially when it's like a second or third opinion, by whether or not you've asked me about cannabis, because we know it's on your mind. We know it's on every patient's mind. And it's always this awkward, you know, can we ask about it? Is it okay? It's okay. Of course it's okay. If it's important to you, it's okay. And it's especially important that if you think this is something important to your care that you're thinking of initiating, or that you've spent a lot of time on. And we're happy to talk about it, because there are sometimes I learn things from patients when they've spent a lot of time learning about some of these additional services or detection devices or supplements, etc. And I'm open to those conversations. We're always open to those conversations. But again, don't be afraid to ask them, because it should be a partnership. And a lot of times, and this is something that I think some people that have had a lot of doctors starting to appreciate, is that doctors have different approaches. I'm a very direct person. I think I'm East Coast, and I think that I tend to be a little bit more blunt and a little bit more direct. And I've had patients that have given me the feedback of they think that I'm being very bleak in terms of their prognosis for their child. Whereas I've gotten the same feedback, the same positive feedback on the same way I've communicated from other patients and saying, thank you, we've known that there are problems. We've known it in our gut this whole time. No doctor was ever acknowledging this. And, it's just really comforting to say that we're not crazy. We're not missing something, that this is something that we see with this type of epilepsy. That's just how I approach things. I don't think that there's anything inherently right about that. It's just the way that I like to practice. It's the way that I would like to be treated if it was my kid that was in that room. And it's hard for me. I do try to accommodate people who approach it differently. But if people want me to be an authoritarian, say, this is the way we're going to do it, this is what it is, 100%, and everything's going to be great, that's not me, unfortunately. There are other doctors who might practice more in that style. And it's okay to say, hey, Dr. Smith, I really feel like you're overwhelming me and making me too in charge of this. Can you just take charge and tell me what to do? And I do often accommodate that to as much the extent to which I can. But it's okay to say that the way that you're communicating is not the way that I like to be communicated with. Where's the wiggle room here? And if you can't accommodate this, is there anyone else who can? Because generally speaking, in the pediatrics world, if there is a specific style that you want, I know everyone in town and I can direct you in the direction of saying, hey, if it didn't work with me, no hard feelings. Perhaps, this person might better suit your style. I will say that goes along with that is as long as anything is communicated with respect, we're always going to honor it. All right. Anytime that you're making accusations or unhappy or no one wants to feel disrespected at the end of the day. But if you're ever trying to say, it just doesn't feel like it's right, I don't feel like we're on the same page, I respect that. We often feel the same way, and that, we're trying to work with you and it's just not working. Is there any way that again, our goal is still the same, even if our communication styles aren't working, we still want things to be better for you. Next slide. And so what can we do in order to kind of avoid some of these pitfalls? Now, this is where I felt like was the most potentially contentious statement of saying, of what I was going to be talking about, which is let your doctor initially, or the nurse at the beginning of the visit, let them initially direct the questions on what we need to know about. There are certain things that I need to know in order to make an immediate decision. I need to know how often your seizures are happening. How is that compared to your previous seizures? Is there anything different about those seizures? What have we done in the meantime? Anything that's changed to provoke those seizures? A collection of very, very specific questions about your seizures before we move on and talk about anything else that's on your mind. And as long as I have that, I can make a decision in the short term, or at least I understand where you're at and understand the urgency and where we make things better. I love hearing about anything that's important to your healthcare, even if it is not necessarily epilepsy related. A lot of times I can't help with it, and I care, but my bias is to help with. I want to hear about things I can help with. And so if you're dealing with severe constipation, that is a very important thing for me to know about in terms of your overall care or your child's overall care. But I need to make sure that before we start talking about that and all the things that you've gone through to deal with that problem, I need to make sure that we have asked enough questions to deal with what I'm responsible for and what I can help with, which is your seizures. And if we go in that direction, if you allow your doctor to kind of point you in that initial direction without getting too much on a tangent in the beginning, it allows us that flexibility at the end of the visit to talk about whatever you want and go on whatever tangents. And it feels like it's a much smoother, much more satisfying encounter for everyone involved. Because I don't like cutting off people any more than anyone likes being cut off. And this also goes to the point of, if you don't understand, ask. We're going to spend that initial time talking about your seizures. We're going to spend that time talking about how have things changed? And again, where are we going with it? And again, if my response is, okay, you've talked about your seizures, and my response is, okay, let's go up, or let's talk about a new medication. And your perspective is, this is something that I've gone through a million times. I don't think the medications are going to be capable of fixing it, or I've done this before, maybe many years ago. You can ask that you can start by saying, you can be direct and saying, Doc, I've done this before and this ain't helping. Or you can say, I'm sorry, why are you talking about a new medication? And I can say, well, it sounds to me like you're having a lot more seizures and we need some help here. And your perspective is, no, this happens to me every winter. The seasons change, my seizures go up for a week and then they go back to normal, and I don't want to do anything about it right now. And I can say, okay. And again, that asking that question and clarifying is really, really helpful. And this is especially true, I had mentioned at the beginning about what to do in the event of a seizure. That is one of the more important topics that we need to have down pat in terms of epilepsy care. And I will deliberately sometimes spend the entire first visit of when a person has epilepsy talking about nothing but what do we do to keep a person with epilepsy safe during a seizure. And I'm completely content to do that because that is the single most important thing. And so if anything is coming up with your epilepsy care, particularly when it comes to what do we do in the event of an emergency, don't be afraid to dwell on it. Don't be afraid to take the time on it, because again, we are really, I'm genuinely happy to review it as many times as we need to, so that we're all on the same page by the end of that visit. Next slide. Other tips are kind of ways to kind of streamline things as much as possible. I think there's a misunderstanding about how often medication refill problems are actually coming from the doctor's office. There are basically 3 people that are involved anytime that there's a medication refill issue. It could be the pharmacy, could be your insurance, or it could be the doctor's office. If it's the insurance, there's a 0% chance that we can fix that overnight or on the weekend, unfortunately. And pharmacies don't always make it clear that this is an issue with the insurance authorization. They'll just say, contact your doctor's office. Bottom line, if there's any kind of issue, please talk to the pharmacist and get an idea as to what's going on, because we don't have that much. We really can't access the pharmacist any easier than you can, to be honest. We're often put on hold for a very long time as well. And often what we figure out are things that you could have called the pharmacist yourself. And also, please be as proactive as possible in trying to get your refills. I've been there. I know sometimes I forget too, but particularly if it's on the weekend. You know, make sure that you've noticed, okay, if you sort out your pill box ahead of time and you notice that you're going to be out on Saturday, you should be calling right afterward to make sure that that refill is going to be available. And then they can, if there is any issue with whether or not the refill is on file, they can call the doctor's office. We can get it sorted out way in advance before the weekend when we have all the staff available to do it. The high level way of also learning about this is in January is when insurances love to start denying medicines you've been on for a very long time. So in January, make a special note. You'll probably need more time to get your refill, because that is right now the Minnesota state law is that that's the only time they can change what medicines they cover. And so they love to start denying all of our medicines right around January. And that's not something that I can solve again overnight on a weekend. That's something that we actually need almost a week in order to sort out with your insurance to make that decision. When do we call? When do you guys call? I know that Dr. Winslow started talking about this. My summary of when do we need to hear from you in between visits, because obviously we don't need to hear if your baseline is you have a seizure once a week. I don't necessarily need an update every single week when those seizures happen. The rule of thumb is anytime you want to make a change, need to make a change, or not sure if you need to make a change with your seizure medications, that's when we need to be involved in that decision. So as Dr. Winslow had mentioned, if we said that you're going to get a little bit groggy on this, want to give your body a little bit of time to get used to it, but you're sleeping for 20 hours a day, that's not groggy. That's something a little bit more, and you're not sure if that's something that's going to get better. Okay, that's a perfect situation of something to give us a call to say, holy cow, this is way stronger than we expected. Is this something I really need to wait out, or is this something that's even safe for me? Or if it's a change in the character of your seizures and it's something that's just making you uncomfortable. I mean, it's not uncommon for me to get a phone call to say, we've been having seizures every night for years. We just had the first one during the daytime, and I'm not sure if we want to do anything about it, but this is a concerning change for me. That is a perfect example of something that should be a phone call to us, because we can have a conversation about what options we have at that point. Generally speaking, we're going to try and compress all of that conversation whenever appropriate to our conversations in the clinic, primarily because I can set aside that time for you. Otherwise, I'm calling in between patients, calling in between meetings, calling when I'm in my car driving, calling when there's other things going on where I can't guarantee that you have my undivided attention during those phone calls. But when you're in clinic, you have my undivided attention. And on top of that, that's the time when I know you and your child best. I've been seeing plenty of kids for years now, and all the information is in there in my head, but sometimes I have to refresh it and I go through the chart every time I see you in clinic. And so we make these plans at those clinic visits because that is the time where I have all those details available to me so I can make those intelligent decisions. Again, on the phone, it can be much harder to do that. And so we generally try to direct towards appointments. And nowadays we can do this a lot through telemedicine as well. For urgent matters, call the office. Again, anything we just mentioned, I just mentioned there. And then in terms of the emergency calls, we do have an emergency on-call provider. Please be kind to us. We are often covering a lot of people. And a lot of times people, again, will talk about a lot of things that aren't necessarily salient to making a quick decision. The rule of thumb there is if you need a decision in less than 1 hour, please call 911. I might be in a patient visit talking to someone else. I might be talking to a patient with 2 other phone calls waiting to be called back before I can get a chance to you. And so if you need a decision more urgently than that, you might need to call 911, unfortunately. Next. I know I'm running out of time here, so I'm kind of going a little bit quick here. I think that we covered kind of most of these things here. You know, again, I have my own personality. You have your own personality. You have your ways you function best. I have my ways where I function best. Communicate. We work together and figure out what's the best way to meet each other's goals of again, whatever that goal is for you, hopefully seizure freedom and side effect freedom. The more we understand each other, the more that we kind of, especially if there's a misunderstanding, we work our way through, build that mutual trust so that you understand that I'm trying to work towards your goal as well. And that I know that you understand exactly kind of the big picture of what I've envisioned. I will have to say, because this is, I'm surprised I do need to say this, but be respectful to all members of the team. If you are, being nice will get you worlds further than saying a rude word. I know every member of our front desk team, our nursing team, they all tell me if they feel disrespected. And that is not the best way to get the best care for your child. I actually would prefer it that you're mean to me than mean to the staff, because I can take it. And it's usually the other way around, unfortunately, that people are nice to me. And be honest, again, we're not here to judge. If you miss medications, or what happens more often in my world, the kid thinks that we don't actually need the medicine, or the parents forgot for a long time and thought things were okay and we decided not to continue it. Be honest about that. That's useful information to us. And we're not going to call the police about that. We're going to actually talk to you and say, okay, what happened that led to this? Was there a disconnect in kind of our understanding about what this medication is for? And it's an opportunity for conversation. If you don't talk to us about that, you know, again, there's not that mutual trust there. And again, we can't help if we don't know about it. We want things to be better. We want to help. And if we genuinely feel bad, if there's something that's been going on, and even if it's kind of, we called once and we had a bad experience and you know what, we just don't want to deal with you right now. I mean, I feel bad about that. I actually want to know about that disconnect so we can figure out how to make things better. And as always, ask. Don't be afraid to ask questions. Make sure that you are 100% on the same page as your medical team. Next slide. And again, I know I'm out of time and this is all just summarizing and repeating myself. So I think I'm just going to skip this so we can spend some time in the Q&A.
Sorry about that. Trying to get it to come back. Thank you, Dr. Winslow and Dr. Smith. That was some really excellent information. I'm checking to see if we have any questions. So a couple things here. Here's one, and I'm just going to let you two decide who wants to take what question, I guess, unless there's one that's specifically for adults or specifically for pediatrics. It seems like wait times for appointments are getting longer. What do I do if my seizures have gotten much worse and they tell me I can't get an appointment for almost 2 months? I'm afraid something really bad will happen before I can see a doctor.
So this is true across the Twin Cities, which is crazy when you think about how many neurologists. Actually, I think we have the most neurologists per capita of any place in the country. And I've been talking to neurologists across every practice, and unfortunately, this is just a pretty universal problem in the city. The short version is that once you're established in one of our practices and you need help, I don't necessarily wait for the visit to help. And so if you call saying I need help and I need to do something differently, we can make changes outside of the visit. My goal with each visit is to chart out a general path and a general approach of what I'm thinking we're going to be doing. And then we kind of enact that in between those visits. But we know that epilepsy is an intermittent disease. And most of the time that when you need the help, it's not going to be perfectly coinciding with when you have an appointment. And so I would encourage you to reach out. And if you're not getting the help you need, to continue to reach out. And if you're still not, if you feel like you cannot get any care done in a timely manner, even in between those visits, perhaps see if there is anyone else that you can potentially see.
I think, and this is just coming from me, not from a question, but you mentioned this being a problem in the cities. And I think, we work with people from across the state. And I think this is even more of an issue in the more rural areas of the state, where there may not be as many, even neurologists, much less epileptologists. Okay. If I go somewhere else for a second opinion, will they have to do all new tests?
So usually I would just say that if you are coming to us, say for a second opinion, we'll usually try to gather the data that was done at the prior place. Ideally, we have that information prior to the visit so that we already have it before we meet with you. That being said, we're not going to we might not have all the images or the exact EEG waveforms. A lot of times we have reports. And so sometimes we have at least have partial information before we see you. And it is helpful if we have that information before we see you so that we can evaluate what should or shouldn't be repeated. It's not uncommon though, if you're kind of coming for a second opinion, we might need more testing. So, and sometimes that's important for us to approach it from fresh eyes, is to see it with the fresh eyes, repeat a video EEG, for instance. Sometimes video EEGs are more likely maybe to be something that's repeated versus images. We can often request that from other places, or lab results. We can request that, and that wouldn't always have to be as repeated. I'm sure Dr. Smith.
I think everything you said is 100% accurate. It's a common concern, a common complaint. There are sometimes nuanced differences that we do pick up by doing that. We can't, unfortunately, the EEGs do not travel very well. And it is something that is not quite a Rorschach test, in that every person sees it a little bit differently. But it doesn't translate always very well to reports. And that is why I take great care to try to include pictures on mine, but most practitioners have not quite gotten there, because I have my way of describing it, but most people don't include the picture where I can form my own interpretation off of it. And so I need to additionally look at the EEG. Because part of it is when we are a second opinion, we're missing something the first time, and we need to kind of go over everything all over again. I will say that is the approach at every top institution across the country. From my experience, the Mayo Clinic does their week-long concierge, do everything in one visit kind of approach, and they do often pick up some good things that way. Does everyone need that? Obviously not. A lot of times we don't pick up a lot of extra things by doing these extra steps. But again, once you're in the second opinion territory, it's because something's being missed, and we often only find the answer by looking again at something that was already done.
Thank you. Okay, we have one here. My medicine helps my seizures, but I hate the side effects, and my doctor doesn't take it seriously when I tell him about it. I'm not sure if he doesn't believe me or if he doesn't care, but what can I say to convince him to switch me to something else?
Just try to, I think, continue to reiterate your concerns. We all could use, we can all benefit from trying to rephrase things. So say, my dizziness is very bothersome. It makes me not able to function. I don't feel well on this medication. I would like to explore other options. Just be kind of direct in what your goals and requests are, and explain how it is affecting your life and therefore not tolerable for you. I would hope that whoever you're working with would, again, listen to that goal and listen to that complaint that things aren't working for you and that you need to explore other options. So yeah, trying to have a conversation.
And I would always say, don't ever be afraid to be direct and say that I'm done with this. I've been dealing with this for years. I'm positive it's this. I've had patients who have said, look, I've accidentally forgot to take it. And I was like, wow, I felt really good that day. And that has often kind of been a very clear, we're ready to come off of it. And there might be good reason to stick with it. I'm going to put that out there of if you've been on 5 other medications and none of them work and this is the only one, then your doctor might push back a little bit on that one. But if your doctor isn't willing to listen to the, I can't do this anymore, I need to try something else before I'm willing to accept this as my life, then I don't think mutual trust exists. And I think that you might need to talk to someone else who hopefully will listen.
Okay. One of the big takeaways I'm getting from this tonight is that idea of goals, because I think sometimes we think about, like you said, Dr. Smith, the goal is to have no seizures and no side effects. But I think having that question about how these problems are affecting your life and that your goal isn't just to get rid of the seizures, but maybe to also improve in different areas of your life that aren't working right now.
So I don't know if everyone else can see it, but I just saw a question pop up and it's a
Yes.
one.
Yeah.
I'll read it out. When you're a parent of a young child with epilepsy and you see things that are concerning, such as possible side effects, but your child cannot communicate it, what do you advise for the parent to do to help?
I think they're talking about a young adult.
A young adult who's not communicative. So I guess there's 2 potential ones here. Whether this is just your typical solemn teenager that just isn't willing to talk about whatever they're feeling, or this is but I probably experience more often, someone with impaired communication skills, either as a result of autism or some degree of brain injury. I guess the question is that how do we communicate to because there are 2 different ones there. What I will say for the child who can't communicate, just listen to your parent instincts. And I always tell parents, just tell me specifically and just tell me, don't tell me they're dizzy because they can't tell you that they're dizzy. Tell me that what I notice is that every time I give them, okay, so this actually might be more for you, Jess.
You can finish your response.
All right, I'll finish that. We'll take it from there. Just be specific without actually putting the necessary symptom on there. That I start the medication, he's very cranky and wants to keep his eyes closed for the next hour after he gets the medication, or for a 10-minute or 15-minute period afterward. And so I can tell he just seems uncomfortable. And then we can kind of infer what the symptom might be from there. But again, that's not what she's asking, so I'll let Jess take that.
Yeah, so I think the first thing is whoever's in the room we will listen to, but we have to listen to the patient first and most. And so sometimes we have to make sure we hear from the patient. But if the patient has welcomed whoever it is into the room to share the conversation with us, then I'm happy to always hear from the family members or friends or whoever's in the room to hear what they say or their concerns. So voicing those concerns, maybe in advance to the patient to, make sure that they hear what you're concerned about. And then if you're able to be in the room during the doctor visit, then you can voice your concern, as well after we give the chance for the patient to comment too. And then, so I think that's probably my best suggestion, just trying to share your concerns with the patient first out of respect for that, as well as trying to share it at the visit. One thing just to be aware of, probably not related to the exact comment, but just to be aware, if someone's over 18 and they have their own decision-making power, they have to give consent for people to be allowed, for us to allow us to talk to people. So just because you're the parent, if the patient's more than 18 years of age, you have to be on the consent for our office to talk to you. And that's just respecting the person's privacy. So trying to have that conversation and make sure the patient has listed who they want on the consent for us to be able to talk to them about it. Is important.
And I think there's some follow-ups on this, but they seem to be pretty specific to actual treatment. So I don't know if that's something that you'd be.
Yeah, out of
Interesting.
respect for the patient, the physician, and the family situation, we'll decline to make specific comments. Sorry.
Okay. Well, that's all we have time for on questions anyway. So I appreciate you, being here once again. Dr. Winslow and Dr. Smith, this has been very enlightening and very interesting information. I hope that our attendees also were able to get some good information that's going to help them improve the relationship and improve, have them feel like they're getting what they need out of their doctor visits. So I just want to wrap up and remind people of who the Epilepsy Foundation of Minnesota is. We lead the fight to overcome the challenges of living with epilepsy and accelerate therapies to stop seizures, find cures, and save lives. I want to remind people of our information services program. We do offer free one-on-one support to individuals who call us, whether those are individuals with epilepsy, their caregivers, or just friends and family, or people who want to learn more about epilepsy. We customize the information so that we can provide you with the tools and resources you need to address all kinds of epilepsy related topics. And we do also have some materials available on our website and some in paper form that we can provide when people are looking for that information.